Hi guys, welcome to my channel. Today I'm going to talk about my journey with TMJ, which stands for temporomandibular joint disorder. TMJ and I have a long history. I started having jaw problems in high school, probably 9th grade or so, but it started with just my jaw popping all the time. That was literally my only problem. It never hurt, it never caused me any issues, it just popped. And I didn't really think too much of it. I did mention it to my dentist and she asked if there was any pain. I told her no, it didn't really hurt at all. And how I wish I could go back to those days where it was just popping and no pain, because I did not know what was going to come. Things kind of progressed over time as I got older. I think like into maybe my first year of college or so, I did start to have pain in my jaw, but it wasn't very often. It would be really intermittent. I would have like 2 days of mild pain and then it would completely go away for months. It was really random, but it didn't really affect my quality of life at all because it just would last a few days. And something you should know about me is that I have a history of autoimmune disease. I was diagnosed with juvenile rheumatoid arthritis when I was 10 years old and diagnosed with Behçet's when I was in college. So I'm no stranger to pain. I would like to think I have a very high pain tolerance, so dealing with like this intermittent jaw pain every once in a while really wasn't a big deal to me. In my early 20s, so like when I was maybe 21 or so, I was starting to have more problems with the jaw pain, and the dentist said, you're probably grinding your teeth at night and that's causing all of your pain, so I'm going to make you a mouth guard that you wear at night, and it just kind of helps to cushion the jaw. So they made me a mouth guard and it helped a lot. It worked really well. It pretty much solved my problems for maybe a year or two. So from like 21 to 23, it was basically all I needed to do was just wear a mouth guard to bed at night, and things were fine for a while. Fast forward to when I was 23, and the mouth guard kind of stopped being as helpful. The pain started to come back more and more frequently, still not terrible, but it was definitely getting more noticeable, and they made me a different mouth guard, and this mouth guard could be worn during the day. Now, I never really ended up getting comfortable with that mouth guard. I never ended up wearing it. I tried it a few times and they kept adjusting it to try to make it more comfortable for me, but no matter what they did, it just was cutting back into my gums and it was really uncomfortable. So I just kind of gave up on that mouth guard. I very specifically remember the point where my jaw no longer was just a nuisance and it was downright lowering my quality of life in a dramatic way, and that was in the summer of 2016 after my daughter was born. I went to my dentist in August of 2016 to get a bunch of dental work done before I quit my job and lost my health insurance, and I brought it up to her just how bad it was, and she gave me a referral to an oral surgeon and a prescription for Flexural, which is a muscle relaxer. I remember a few months later, so it was like in February of 2017, nothing was really helping. I was taking Vicodin on and off, and the pain was so bad. This jaw pain affected everything. I couldn't smile, I couldn't talk, I couldn't laugh, I couldn't eat, I couldn't do anything. I remember I couldn't even open my mouth wide enough to like eat food normally. If I was eating a banana, I had to like nibble around the edges of the banana, and I couldn't eat sandwiches, anything that required me opening my mouth more than like a half a centimeter. I just couldn't do it. My jaw was locked shut, so I physically could not open it any more than that. It was definitely in spasm, and it was just the most pain that I've ever been in my life. And I was dealing with that for a few months, probably like 3-ish months of just like peak debilitating pain. I could not even live my life normally. It was always on my mind. The pain was so bad and it affected so much just with like talking and smiling and eating that it was literally the only thing I thought about from the time I woke up in the morning to the time that I fell asleep at night. Nothing else was on my mind. It consumed every ounce of my being. The pain was so unbearable that I couldn't do anything else. That's just all I could deal with. I want to be clear that I was never suicidal by any means, but I would be lying if I didn't frequently think that I would rather be dead than live like this the rest of my life. because the thought of living another 60 years with that pain was just really overwhelming to me. I couldn't imagine it, and the thought of it was, I cried a lot. It just made me break down crying, thinking about having to live my life like that. It was when I reached that level of desperation and depression from the pain that I sought out the best TMJ specialist in my area, because she was not like a conventional doctor. My insurance wasn't going to cover any of it, so I applied for care credit. I went to this doctor, the TMJ specialist, and she fitted me with something called a MORA device, M-O-R-A, and that stands for Mandibular Orthodontic Repositioning Appliance. It went on my lower jaw, on my lower teeth, and the purpose of this appliance was to bring my jaw down and forward to open up some of the space in the TM joint. Well, I received that appliance in February of 2017. I think they recommend that you wear it for like 6 months, but I was also pregnant with my second baby. You know, going through labor and delivery of a baby is really stressful on your body. There's gonna be like a lot of clenching down probably, and maybe some trauma to the joint. So they recommended that I just keep wearing it even past the 6-month mark, which I did. And anytime that I would try not to wear it, my jaw would flare up in just incredible pain. I would say that over the course of me wearing the device, my pain was tolerable. One of my biggest frustrations with TMJ was finding doctors to treat it, because doctors either wanted to shove me off to just like a pain specialist to give me opiates and narcotics and stuff. Nobody was willing to actually fix my face, like fix my jaw, because I'm sure structurally it's not good at this point. I ended up wearing the MORA device for about, I want to say like 10 months or maybe close to a year, and then I finally got to a point where like, so my jaw was not all better. I could definitely open my mouth a lot more than I could previously, so I did consider it a success, and I did consider it worth it. In terms of like pain, it didn't do too much. I still deal with pain. However, I will say that things are different now. It is now 2019. It is now about 2 years after stopping the MORA device, and where I'm at now is I basically have flare-ups of pain. Like currently, I would say right at this very moment, my pain is a 2 or a 3, which is, those are my good days. And then on my bad days, which I just had a flare-up a couple of days ago, it just literally ended like 2 days ago, and it lasted for about a week, and the pain was, on a scale of 10, it was a 10. I would say that out of a month, I spend maybe 2 weeks out of every month in like insufferable pain. 1 to 2 weeks out of every month, and then maybe 1 to 2 weeks of mild to moderate pain. And for me, that's good. Back before my treatment with the MORA device, every single day of the month was a 10. I would say that just getting a break from it, so like right now I'm, like I said, probably a 2 or 3 on the pain scale, because I get these breaks. I get a few days or up to a week at a time where I'm not in a whole bunch of pain. It makes it all the more bearable to me. And I know that whenever I get a really bad flare-up, I just know, and I tell myself that it's not going to last. It will go away, and that's what helps me get through it. I just basically have to put up with it for a while, and then I'll get a break. And then it'll happen again, and then I'll get another break. And I just kind of accept that that's how I'm going to have to live my life, I guess. I don't know. I don't really have much of a choice. I've talked to the rheumatologist about it. I've seen a TMJ specialist. I've talked to my dentist about it. I was given the referral to an oral surgeon, but I ended up not going. I did a ton of just research, and they basically would have done like a procedure where they go in with a needle and like a catheter, and they flush out the joints with a saline solution and like some medicine that helps lubricate it, and some pain medicine like lidocaine. But from everything that I saw, that's a very temporary fix. Like you might feel better for a week, and then it just goes right back to where it was before. And I didn't really see any point in that, because that's how I already am. I already will have like a week of relief on my own, followed by more pain. And the difference is I'm not paying a crap ton of money out of pocket, which I would be for any kind of jaw treatment because insurance is ridiculous in the United States and they don't want to cover any jaw issues. Medical insurance wants to throw it over to dental insurance. Dental insurance says no, it's a medical issue. So they just kind of like, nobody wants to take any responsibility for covering TMJ issues. So people who suffer with TMJ are often left to pay for everything out of pocket. And that's one of the biggest setbacks in getting treatment. I just kind of have accepted at this point that this is my life. Everybody has something that they have to deal with. And I've just come up with a lot of coping mechanisms, I guess. I would say that out of everything that I've done to this point, Flexural has been the biggest thing to help me. I was taking it regularly for a long time. I've kind of stopped just because, you know, again, I don't want to be on a muscle relaxer every single day of my life, but it does still help me whenever I'm having bad flare-ups, and I'm glad that I have it. I'm glad that it's something at my disposal to help me. And guys, I've tried everything. I've gone to a chiropractor. I've done all kinds of like essential oil rubs. You know, I've tried going back on like all of my arthritis medicines just in case this was like primarily an arthritic type of situation. But I didn't really notice any difference with my TMJ while I was on my immunosuppressants. I've tried stretches. I've tried all kinds of oral medications. I had read really good things about diclofenac helping with TMJ pain. So I was on diclofenac for about a year and I finally went off of it because it was giving me the worst mouth sores. For me personally, I just accept that this is going to be something ongoing that I live with and I deal with. And I'm at a point now where I'm not in pain every day and I manage it the best that I can. I go to a massage therapist like once or twice a month just to help with like the tension in my body and in my neck and in my shoulders, which in turn can help relieve jaw pain a little bit. I have my Flexural, which really helps. I try to just drink a lot of water to help keep my joints lubricated. Ultimately, it comes down to structurally my jaws are damaged. They're very severely blunted and there's a lot of scar tissue from inflammation and they're just damaged. I swear I've gone through like all of the stages of grief with this TMJ. Seriously, and now I'm in like the acceptance stage, I guess. I would say overall, big picture, Flexural, if you have TMJ, get you some Flexural. I think that's been the biggest thing to help me. The MORA device was very helpful as well. Definitely did not cure my TMJ, but it did help open up my jaw space a little bit so that I have more mobility. So if you are dealing with jaw pain, I seriously feel for you and I'm really sorry that you're going through that. It's one of the most frustrating things that you could deal with. Chronic pain is shitty. I don't even know how else to describe it. I wish that I had all the answers for you. I wish that I could come on here and tell you like this magical cure, something that 100% helped me and I'm all better, but that's not really the case. If any of you guys have TMJ as well, please feel free to comment and let me know what has worked for you in your journey, what hasn't worked for you. Did you have jaw surgery and how was your experience with that? Because that's, you know, one avenue that I have not gone down yet and I'm still not quite ready for that yet, but maybe I will be in the future. So it'd be really interesting to hear from you guys and just see if anybody has experiences with it. I would love to hear from you. So yeah, that's my story with TMJ. Thank you guys so much for watching and I will talk to you again soon. Bye.